Hi, Dr. P here, and in this video I'm going to talk about piercings and tattoos. And I left a short video on Instagram kind of outlining what we're going to talk about here. But the most important thing is to give you just a little brief anatomy of the points. There are 12 meridians. They start, some start up top in the hand and at the top, more cephalic toward the head. And they run toward the feet, and some start in the feet and they run toward the head. And you have 8 extra points for various conditions. And we usually use acupuncture for pain control. Not everybody's a candidate for acupuncture, so there has to be a screening that's done to see if you qualify to have that procedure done. But when it comes to piercings and tattoos, I've noticed a lot of piercings. Tattoos are everywhere, but the piercings are the ones that I question, because the piercings are in areas which means they're constant stimulation. The average treatment time is anywhere between 20 minutes to 45 minutes. It depends on the practitioner, depends on the nature of the condition that's being treated. That's up to the practitioner in most cases. Then the angle in which we needle is important. Okay, so it could be straight, it could be on an angle like this, it could be surface in the skin. That makes a difference. Depending on which way you twist it, you can stimulate or you can sedate. So I'm using this little guide here so I don't stick myself with a needle. The needle looks something like this here. This is a small acupuncture needle, as you can see, about 1 inch and a quarter. But like I was saying, there's certain techniques that the practitioner will use in order to gain the most optimum therapy for the condition that's being treated. Now, piercings here, okay, we see a lot of the piercings right here. Like I said, that's large intestine. 20, that's for sinusitis, rhinitis, facial paralysis, but it's also used for ascarius. Ascarius is a parasite or a worm infection in the bile duct. Now, you know, your bile is something that's manufactured by your liver. The bile duct carries the bile, or it is a tube for the bile to be transferred to the gallbladder. But you can get an infection in there. So I wouldn't know why you would stimulate these points right here and keep constant stimulation there. The other, now there's a point right here, it's called governing vessel 26. We use this point. If a person faints, you can take your fingernail and stick it there. If you have a needle, we would stick it there, and that would bring that patient or person back. It's not something that you should do. Hypertension is a point right up here. We use that to help reduce the blood pressure. That's a point that I can stick. Usually if you have a headache, we follow the ears up, we go to the apex of the area, and then we stick it. Okay, I'm just leaving that for demonstration purposes. But anyway, like I said, we rarely see a person walk in like this here. Usually they will have piercings here. They will have piercings in the lip. They will have piercings in the tongue. There are treatments that we do for the tongue. I will use a device like this, which you can see it has needles on it. But these needles are to be used for a short stick, and it's not something that's left there for a significant period of time. You have certain points on the tongue, but we have patients who have come in and they've had the tongue completely pierced. Now, there are some problems with a lot of these piercings. You can damage the tissue because they can get caught in something, out of clothing. When you turn over, we have to be very careful by administering therapy, where we're actually palpating the patient's body parts. Namely, the most common one that I'm really careful about and leery of is the umbilical point. Okay, and so that's conception vessel number 8. You go to your belly button. That's a forbidden point. We don't needle that point. That's not something that an acupuncture would needle. They can use other treatments. We use nanolight therapy, where you can use light over that area. It's a good point for the orchid gland for men. It's a good point for in conjunction with the anal point, or the points near the testicular area. And so we use that in combination for conditions that are below the navel in the navel region or, that area. So, but we have patients who have piercings in the testicular area. They have piercings in the penile area. They have piercings in the clitoris. They have piercings in areas that are forbidden for acupuncture. Nipple piercings, that's a forbidden point. So you don't, but we have patients who have had complete piercings, ring piercings in the nipple. Now, like I said, this is fashionable, but I often concern myself with whether or not this patient with constant stimulation like this, it might trigger some sort of reaction in the body's organs. For instance, like if you have piercings, certain piercings can cause hepatitis. So we're talking about hepatitis B, hepatitis C. These are contagious. Sarcoidosis, very common in blacks that have sarcoidosis. Okay, so you don't want to trigger a condition that you don't have by some sort of fashion. Scars. If you have keloid skin and you know your skin keloids, you need to be tested. You can be tested first to see where your skin keloid if you have some sort of surgery or some sort of piercing. But I would be most careful because that's not something that is, something that you have to have. Like I say, it's elective, it's fashionable, but if you can avoid it, I would most certainly avoid it. We have to be careful of patients with pacemakers, patients with breast implants. Do they have some sort of, this is a contraindication for certain acupuncture treatments. Now, also you have auriculotherapy. This is very common. We see piercings, of course, women will have piercings in the earlobe, but piercings along the rim of the ear. The ear is a small version of you. This is what we look at when we see it. You can see all your body parts in here, your liver, your spleen, your heart, your brain, colon, everything is within this ear. There are 2 points that's probably the most common points that are used, Shen Men, but common points that acupuncturists use in the ear with using auriculotherapy is points to reduce smoking. So if you want to get rid of smoking, there's smoking points there. There's appetite suppressant points there to help you lose weight. Those points do require constant stimulation, especially like the auriculotherapy point for the appetite suppression. But it's checked. We check that every week. And then we will remove the small acupuncture tack. But like I say, the stomach 17, which are the nipples, we have patients who have piercings through there. We have patients with large intestine here, 20 piercings through there. The belly button, conception vessel number 8, which should never be pierced, we have piercings there. So you want to make sure that, you consult with the technician who is performing that. They may not know acupuncture, so you have to consult with your doctor, someone who's experienced with acupuncture therapy, an acupuncturist. These are things that you want to consider before you embark on having something like that done. Now, tattoos, the biggest question with that is the ink or the dye that's used. And like I said, there has been no ties to cancer that we know of. It's an area that's still being researched because we're looking at the body being, it's not a surgical procedure, but it's an invasive procedure. So when we talk about the piercings, we're looking at a dye. We don't know the effects of the dyes, and some patients will have the tattoo removed if it can be removed through laser therapy. But I question, the dye covering the pores of the skin. Do you have proper respiration with sweating and what have you? So, and what about scars? Scars is very common in Black people with keloid skin. And so, when you look at a scar can interrupt the flow of nervous energy. It can throw you into a different type of nervous system dominance. And so when I look at scars, we have to laser those scars and then have that patient utilize wheat germ oil or sesame seed oil to deactivate the scar, because in many cases you can be in sympathetic dominance where you're constantly stimulating the stress hormones. That's your cortisol and your epinephrine, norepinephrine. So we don't want to stimulate stress hormones when they're supposed to be at a more balanced level, and you're not under stress. So you can initiate certain processes in the body by having these piercings and tattoos. And like I say, you want to make sure that you have the proper information before you have that done. Now, I'm sure that the piercings that are being done do not, let me just take this out here. Most of the piercings that are being done do not adhere to the angle at which you insert that piercing. That makes a difference. Or for us, with whether or not we twist it to the right or to the left, it depends on whether you want to stimulate the insertion of the needle, you want to cause stimulation, or if you want to cause relaxation or sedation. These are things that techniques that the acupuncturist or person administering, the doctors administering acupuncture will use. It's things that we all know. You're doing that for therapeutic purposes, okay, for the condition that you're treating. For pain, it's the most common usage for acupuncture, but there's so many other therapies with the combination of points that we use for conditions that patients may present with. So, like I said, it's something that you might want to consider before, because now when you have that removed, what about the one in the tongue? Well, the body is very resilient. The body will recover, but it's going to leave a scar. You want to make sure that you have if you remove any piercing, make sure you have that lasered. Okay, lasered, the use of wheat germ oil and sesame seed oil to completely deactivate the scar as a result of the piercing. And also, if there's a treatment that's external, that'll work. I'm not sure about the treatment with the, we can definitely laser the tongue. I'm not sure how effective the sesame seed oil and wheat germ oil is, because now you're getting into taste, and many patients don't like the taste of certain things, especially therapeutic things. You can use nanolight therapy, where we use the lights for the acupuncture points in terms of treatment, but there's a point for scars also. So you want to look, I hope this information kind of helps you a little bit in determining whether or not you want to have this done. Like I said, most patients will have this done as a fashionable type of procedure, but there are some medical implications, certain pathological findings that can occur that you want to make sure that you're not part of that. Okay, best in health.